Thank you so much, Cyril. I'm going to share my screen. Colleagues, greetings. I'm Brian Morales, and welcome to the Global Coalition to Address Synthetic Drug Threats Subworking Group 2.2, April 23rd session, West Group. I have a few administrative announcements to get us started. We're going to review the meeting schedule, the website, the initiatives, and the recommendations. I want to start off by thanking all of you for your valuable partnership and participation over these long months. The synthetic drug challenges, unfortunately, continue to worsen during these months, and we have seen the continued emergence of new synthetic drugs and the rapid spread. There are countries that are facing national emergencies, and we had just a week and a half ago the president of Sierra Leone declare a public health emergency over a synthetic drug called Kush in that country. The discussion on synthetic drugs, however, at the same time have risen to a new level of prominence, and at the CND last month, we heard national statements from delegation after delegation about synthetic drugs and in favor and support of the coalition's work. We also had two global coalition meetings there, one for donors and one as a general informational session. And then we also had many side events around the issue of synthetic drugs from governments, from international organizations, and from civil society. One NGO in particular, the Global Initiative for Transnational Organized Crime, had a very interesting map that I want to share with you. This is the expansion of the synthetic drug market over the past 2 years. And you can see in red countries where the synthetic market, the illicit synthetic market, has increased in severity, in orange where it has remained unchanged, and the few in green where the market has decreased in severity. So this is an issue that is bad and getting worse. We are currently in the middle phase of our Global Coalition's first year, which is action planning and implementation, beginning this month in April and stretching all the way until July. So what are we going to do during these months? Well, ways to participate. We would love to hear your national experiences. If you are interested to present on any topic, please follow the link in the chat that we are pasting. And also, you can see that the link here in the on the slide. And please indicate what topic you'd like to present, and we will try our very best to incorporate you into the agenda over the coming months. We will continue having discussions on global initiatives now as we enter the operational phase. And we're also looking at engagement of other sectors. So civil society, private sector. We've had universities that have also come together and been developing ideas as well. If there's interest in workshops and trainings, we may not have space to do that during these coalition meetings, but we could have separate training opportunities. UNODC has a wonderful training for policymakers on addressing drugs. It's a 101 that everyone should have. So for those that are interested, we'll work with UNODC to see how we can make that happen. Now, operationalizing the coalition means that we are now taking the recommendations and finalizing them today. I have there on the slide that we have 60 recommendations. We actually have 56 because 4 of them were collapsed into others during the last sessions of the East Group last week. So we have 56 recommendations. We have then from the recommendations, concrete actions that we will be looking at taking. Another way to think of them are measures that you can adopt. And so we're going to be asking all of you individually, what are you doing? How can we document the work that you're doing to demonstrate that these actions are being taken in support of the recommendations? So you might ask, well, what does it mean to share an action or to declare that I'm taking an action? Well, there's a few different categories. You can express interest in one of the 115 initiatives of the international organizations. You can express interest in more than one, and as many as you would like. They are all located on the website, but that is one area where I really want to call your attention and ask you to take a good look at all of those recommendations. Second, you could provide assistance, which could be financial support or in-kind support on a synthetics topic. It could either be to an international organization or it could be bilaterally to another government that you want to support, mentor, collaborate with. Third, you could adopt at a national level a new practice, a new policy, a regulation, or a law. You could also consider engagement and collaboration with the private sector. And you could host a global or regional meeting of the coalition on a thematic area of interest. If you are interested in hosting a meeting, we encourage you to reach out to us at Global Coalition at Synthetics Coalition at state.gov. It's been a long 4 hours. And I will be happy to, and the team will be happy to discuss those options with you. So let's now move on to the sort of the phases of where we're going from here. So indeed, we are looking now to identify, beginning this month, on actions that you're all going to be taking to support the recommendations. We will begin the concrete initiatives of the international organizations between April and August. Not all 115 it'll be a subset of that, but we'll see, what is possible. And then we'll be looking at achievements, at concrete achievements that are basically the culmination of work from July of last year through July of this year. And that will be then documented and highlighted in a year one report that we hope will be released at the UN General Assembly in New York in September. Then in October, we begin our second year of the coalition, and that's the full implementation phase. So that is where each international organization carries forward their respective actions. We put at the forefront the concrete activities and initiatives, and then we will be looking at measuring outcomes by this time next year, so that by July we can develop a year two report that then has outcomes in it and is released at the UN General Assembly meeting in September of 2025. So where do we find these 115 initiatives? On our website, in the middle tab, you'll see initiatives. When you click on that, you will see the listing either by sub-working group, or directly you can just go down and read them one by one. And if you click on any one of these, here's an example. You'll have there beyond the title and background, the accomplishments, the activities, outcomes, and then you'll also have at the very end the flags of all the countries that are participating. And you could certainly register then if somebody's participating from your country, but you're also interested, you could reach back to the email address provided in the link just above that and express your interest. If your country is not participating and you're interested, you can just directly email also and express your interest to participate. I have to provide the caveat that just because there's an expression of interest does not mean that there are resources available for the international organization partners to carry out and to meet the demand of so many countries that are reaching out to them. So this is first and foremost an expression of interest. INL, in concert with other international donors, partners, countries, private sectors, will be looking at how we can support the demand that is generated through this exercise. But please note once again that we'll do our best, but it is yet no guarantee of participation. And we will also be looking at working with the international organizations to see how we can more efficiently work with a collection of countries on individual projects to be able to meet that demand. Now, I want to share with you a new feature on our website, which is a coalition discussion board. You should have received emails last month for this feature. If you have not, and you would, or you misplaced it, you can email us at syntheticscoalition, again, at state.gov, and we will send you an updated registration link. What does this feature look like? Well, you'll notice on the right-hand, upper right-hand, you can now log in once you have established your account. When you log in, you will enter your username and password. And when you do so, you will then notice that you've got your profile button as well as a community button. And on that community button, if you click on that, you will then see your profile along with all of your sub-working groups that you have registered for, or you can add others as well to the group. I'm going to select one, sub-working group 2.2. When I open that one, I see a timeline or a news feed, very similar to Facebook or LinkedIn or other social media sites. You can now click up there, say something, post something, news articles, research studies, emerging trends, and you can add images, documents, etc. Here's an example. I added this news story about the public health emergency in Sierra Leone that I was mentioning earlier. And then we had our friend Donald Conte from Sierra Leone write back and provide a message, and then I could respond to that, or others can ask questions. So this is a mechanism for us to remain in contact with one another outside of our monthly meetings so that we can have more natural and recurring conversations on the issue of synthetic drugs. It's only open to those that have registered for this feature. So you can't read the content from the outside. You can only read it when and have access to it once you have registered your account and log in. So now I want to move on to the recommendations, and then I will turn it over to our co-chairs for today's meeting. As the first item today, we are going to finalize our recommendations, and I want to note that we will then be posting them on the website following the session today. So at the top, we are adding what I'm saying is a chapeau or a sort of preambular text, and I will read it to you all. It states, "The recommendations herein are non-binding and for future government consideration where appropriate. They reflect the views of technical experts participating in the Global Coalition and do not reflect a consensus of governments or a single national position." So this is added because while many of us participate in multilateral negotiations, this is not an internationally negotiated national position that we're looking at. We are technical experts sharing our views as government experts on different recommendations, but the purpose is that this becomes sort of a home for or a guiding kind of principles for the concrete actions or initiatives that we want to take. And governments are not obligated to adopt all of these. They can adopt recommendations outside of these as well. So with that, I'm going to quickly scroll up to 2.2, which are our recommendations for this sub-working group. And I want to highlight the following. We have 4 of them there on the board. The recommendation of the co-chairs from sub-working group 2.2 in the East session was that we erase the distinction between 2.1 and 2.2 and make these recommendations, along with the ones that were previously presented, the recommendations of working group 2, so that there isn't a distinction, because there was a feeling that the recommendations of one sub-working group were relevant for the other as well, and there was a lot of sort of cross-pollination that was useful and necessary. So with that, let me read them one by one. 17, develop, resource, assess, implement, monitor, and evaluate national drug strategies and synthetic drug action plans through support, upon request, from international and regional organizations and in accordance with national legislation and regulations. 18, develop and participate in an international network for legislation on drugs, INLAD, to support the development and review of legislative, administrative, and policy initiatives and assessments by legislative and executive bodies. 19, assess rapidly evolving regional synthetic drug challenges by hosting and/or participating in frequent recurring meetings of regional partners, intelligence analysts, and other networks to develop regional responses through dialogue, policy adoption, coordinated actions, data sharing, and program implementation. And 20, establish protocols and promote the use of existing global platforms for rapid exchange of information related to cross-border threats upon request and in accordance with national legislation and regulations. I'm going to stop sharing my screen, and in turning it over to the co-chairs, the first order of business will be to review to see if there's any final edits or comments to these recommendations. If not, then we will move on to the program for today. But I will turn it over to our co-chairs, and we have Jenny Fagua from Colombia's Observatory on Drugs, and our colleague Clara Mall is stepping back, but we have Natasha Bergen, the Director of Health Improvement from the United Kingdom's Department of Health and Social Care, that will also be taking over. So we're very grateful. Natasha, thank you so much for joining. And I'll turn it over to you then to review if there's any edits on the recommendations, and then to proceed with the agenda for today. Thank you.
Gracias, estimado Brian. Un cordial saludo desde Colombia. En este momento y el día de hoy me encuentro cubriendo a Jenny Fagua, que se encuentra en otra actividad. Digamos que para dar inicio a nuestra discusión
my
del día de
apologies,
hoy,
can we ask the speaker to speak closer to the microphone, please? Your audio is breaking up real bad. And we would like to ask you to speak closer to the microphone. Thank you so much. And please go ahead.
And my apologies, Daniel, I forgot to recognize and mention you.
Disculpe.
Muchas gracias, Daniel. Thank you, Daniel, for filling in
Gracias.
for Benny.
Estábamos acá analizando las proposiciones, la recomendación de nuestro subgrupo de trabajo 2.2. Desde el análisis que hacemos, pues indudablemente vemos cómo el desarrollo de la plataforma web de la coalición tal vez se ajusta a estas descripciones de los numerales 18 y 19, donde claramente podemos marcar la participación en tiempo real. Los invitamos a los asistentes, a los miembros de este grupo de trabajo, a que se inscriban y hagan parte de esta plataforma, porque de esta manera podemos tener esa cercanía en tiempo real, intercambio de información sobre las tendencias o dinámicas de las drogas en cada uno de nuestros territorios. De esta manera, y siguiendo las recomendaciones de Brian, el día de hoy, pues, Clay nos va a acompañar, pero tenemos la presencia de los colegas del Departamento de Salud y Atención Social del Reino Unido, Amy, Cry, Charlotte, quienes pues siéntanse libres de pronto al final de cada una de las sesiones de participar o colocar sus observaciones al respecto. En el momento inicial, el día de hoy, nuestro grupo de trabajo 2.2 tiene dos principales presentaciones. La primera de ellas está relacionada a la intervención del doctor Matías López de la Oficina de Gobierno de la República Checa, quienes nos contarán sobre los nuevos modelos de regulación de sustancias psicoactivas en la zona gris, un nuevo desafío u oportunidad para cada uno de los países. Entonces, en primer lugar, damos la palabra al doctor Matías López para que haga su intervención. Doctor, tiene la palabra.
And my apologies. Before we do that, I would like to address Diego. Diego, we're getting a lot of background noise from your location, and it's very difficult for the interpreters to interpret. So we would like to ask you to moderate this session to move to a quiet location and continue from a quiet location. Diego, thank you very much, and I'm handing over to the next speaker.
Hello. Thank you for the floor. I'll try to share my screen here. Right away. Yes. Okay, so my name is Matthias Laki. I'm working for the Czech government for the Office of the Government Drug Department. I'm member
Matthias,
of the...
Matthias, my apologies. Right now, your PowerPoint presentation is in the presenter mode. You may want to move it to the slide mode. To do it, please click slide presentation at the top and then start show from the beginning. Start slideshow from the beginning. So that way we're going to see the entire slide on your screen.
Yeah, sure. 1 second. No, sorry.
And on your left, you should see a button that says from beginning.
Sorry, I can't see it here. How about now?
No, we can still see the small thumbnails on the left, and when you click in the slideshow at the top of your screen, there we go. Now we can see actually two screens, but it seems to be better. Thank you very much. Please go ahead.
Yeah, sorry about that. Technical issues. So as I was saying, I work for the Czech government. I'm a member of the team that is tasked with regulating or suggesting the regulation of the psychomodulatory substances that I will be talking about today. Also, I'm a member of the team that's tasked with finding possible ways for regulating cannabis here in Czech Republic, or certain aspects of the manipulation with cannabis. Also, we're looking into a certain degree of decriminalization or lowering of the sentences imposed for the drug crimes. Just briefly, I'll be talking about quickly about the situation or the context in Czech Republic regarding addictions and psychoactive substances. about Czech drug policy, but mainly I'll be talking about the new proposed legislation regarding the new psychoactive substances. So as you can hopefully see on this slide, given that Czech Republic has roughly 10.5 million people, so fairly small country, probably to the majority of the countries that you're from, we have quite high incidence or prevalence of use, especially in tobacco, alcohol, psychoactive medicine, cannabis, and methamphetamine, which is sadly kind of a traditional statistic for Czech Republic. On the other side, what's also traditional for Czech Republic is quite well-esteemed drug policy and well-established network for treatment of addictions. You can see that we have on our territory 250 to 300 treatment services. That's only services for addiction. It's also integrated policy, so there's more services regarding healthcare, regarding social work, regarding psychiatry. So I'll be talking a little bit about that. Here I have like a basic scheme of the Czech policy. Now from 2022, fall of 2022, we have a new government that is more democratic compared to the previous, more, let's say, authoritarian leaning government. So the drug policy moved towards harm reduction, moved towards prevention, and most importantly, it moved towards regulating substances based on their level of harm. This is taken directly from the program statement of this current government. And as you can see, this is the cornerstone of the addiction policy of this government. This is the graph that probably I don't have to introduce to any one of you, but it is important for the Czech drug policy, and mostly it's important for why did we even come up with a new regulation, and the key to understanding what is in the regulation or how the regulation works. So that was just a brief overview of the context. Now I'll be talking more about the psychomodulatory substances themselves. So what are the psychomodulatory substances? It's a new term. The new term we invented to differentiate this group of psychoactive substances. Here you can see that's the definition. The first half of the slide is the definition straight from the proposed bill. And you can see that the psychomodulatory substances have two material characteristics, which is a psychoactive effect or psychoactive property and low, let's say, risk to public health and social consequences. And also one formal characteristic, which is that it is listed as a psychomodulatory substance in the government regulation. So these are the defining characteristics. Basically why I have the asterisk there, because that's our link to the European legislation, which states in this Council framework decision that you see there that the member states regarding the new psychoactive substances, in addition to the obligations given by the Council framework decision, can also implement national control measures that they seem appropriate. And in some cases, we believe that to be true to the U-shaped graph, to be true to the Czech policy, new regulatory framework is necessary. Examples of the possible psychomodulatory substances are kratom, that you can see on the picture there. Also, we call it the low potency THC, basically cannabis that is up to 1% of THC content. Psychomodulatory substances are designed to be a separate category, new category, separate from food, separate from medication, cosmetics, illegal drugs. It's a new category on its own that is basically psychoactive substances designed for human consumption. Why is this regulation necessary? Basically, at this point in Czech Republic, we have quite a vast market regarding this newly emerging psychoactive substances. There's quite a boom, and not only in the number of substances, but also in the volume. We have quite high numbers of people using it. For example, I mentioned kratom, which is, according to our National Monitoring Center estimates, 6% of people in Czech Republic have tried kratom, and 3% of people have tried it in the last year. For example, numbers for the CBD cannabis are even higher. It's, I believe, 15% of people have tried it, and 7% of people have tried it in the last year. So you can see that it's quite a high number of users. We're talking about hundreds of thousands of people, but this market is currently completely unregulated because the sellers are avoiding all forms of regulation. Most of the substances are, or all of the substances are not listed as illicit drugs. Also, they cannot be considered food because they are marked as collectibles. Officially, they're meant to be bought and put on a shelf as a collectible, so the food legislation doesn't fall on them. There's a lot of constantly newly emerging substances. We don't know about their characteristics, that they're quite unknown. Many of them are quite unknown to the state government and all the bodies responsible for monitoring. There's complete lack of state control regarding quality, content, dosage, and especially what's the biggest problem probably at the moment is uncontrolled availability, especially for minors. So the only regulatory framework that the Czech government has available at the moment is prohibition or listing them as illicit drugs, which is quite extreme. And in the case of many substances, we don't believe that we would be falling with prohibition in the center of the U-shaped graph. Also, given that we have hundreds of thousands of users, listing those substances as illicit could pose quite a serious risk for a lot of people who don't pose big threat to society, or would be not in the interest of state to let's say send them to prison for possessing something that just became illegal. We had a big problem with this regarding the HHC, hexahydrocannabinol, which was widely used by patients, oncological patients, or elderly people using it instead of THC for certain medical properties, and then it became illegal. And what also happened, why this regulation is necessary, that the day HHC was banned, 7 new substances that are almost identical in everything, except that they are quite, I believe all of them are synthetic. That's also a trend, that substance is banned, and then the newly emerging substitutes for the substance are quite always synthetic. That's why we are trying to propose an alternative solution, which is the psychomilitary substance framework, which should satisfy all the sides, given that it focuses on protecting people, but at the same time providing a sort of safer supply of the psychoactive substances. The key aspects of this regulation, which is currently in Parliament, so it's not in force, but it's expected to come into force before 2025 or around the breaking of the year. The 2 main categories that we introduced there is scheduled psychoactive substances. I didn't talk about this category, but it's a sort of a catch-all category that basically all the newly emerging substances can fall into this category. They cannot be sold, they can only be studied. There's ban on advertising, so basically everything that emerges should quickly be put into this first catch-all category and only allowed to be studied. From there, after 2 years of examining the substances, here you have the factors that would be considered, like toxicological properties, addictive potential, international recommendations, and other. The government would decide should they be listed as psychomodulatory substances, which can be then traded legally, or they should be put into illegal drugs category or addictive substances, or, for example, the psychoactive effect is not proven, and therefore they should be considered food or novel food under the European legislation. Should those substances be listed as psychomodulatory substances? Basically, very, very simple terms, the regulation would be similar to them as the regulation that is currently in effect for tobacco, which means there would be ban on advertising, ban on vending machines that are a big problem with the new synthetic drugs here and newly emerging substances. Online sale would be available only if there's a strict and clear identity confirmation. The people who would be selling them would need a license from the government. There will be very strict requirements for quality control, mandatory warning labels, and a host of other measures to prevent minors from getting to psychomodulatory substances, and also providing the highest level of quality control and government oversight. There would be administrative and criminal offenses linked with out of the law dealing with psychomodulatory substances. Administrative offenses quite high, especially for Czech Republic, $42,000 fine for corporations, $2,100 fine for natural persons, and up to 8 years imprisonment for illegal distribution or handling of psychomodulatory substances. It's basically similar offenses we have now for drug crimes or unauthorized business. How does this all relate to synthetic substances? Basically, this regulatory framework is a possible new framework for synthetic substances, should they prove, to put it plainly, safe enough to be traded. Already we know that the process of evaluation would be very rigorous, would be very extensive, and out of all the substances that we are even considering, only maybe kratom and the low potency THC cannabis is at the moment considered. But it's still not sure. It's still not a sure thing that those would be the psychomodulatory substances. It all depends on the government. How it also allows us to create a system that evaluates and studies the newly emerging synthetic substances extensively. Basically, there's the catch-all category where all the newly emerging substances should fall under and would be examined thoroughly. There's the aspect of should there be psychomodulatory substances available for people that, let's say, would be of natural origin. Maybe there will be less of a demand for the synthetic equivalents or the newly emerging equivalents. Therefore, the demand for the new synthetic substances could fall should we provide a safe and government confirmed alternative. And there's always the possibility that should some synthetic substance prove safe enough for the market in Czech Republic, it's possible that it would become a psychomodulatory substance. It would be listed as such. So conclusions, this regulation is trying to implement the government statement to regulate psychoactive substances in accordance with their level of harm. It provides the possibility of the Czech government to create a more effective framework for studying and control of the synthetic psychoactive substances. And it's really important to notice, to mention that this bill is currently in the parliament, so it is not a bill that is currently in force. We will be notifying it with the European Commission, which will happen soon because the current process in the parliament is closing. It's coming close to an end. So we hope that this bill will be in force at the year 2025. So that's all from me. Thank you for your attention. And should you have any questions, please don't hesitate to write on this email address. I will try to answer them all. So thank you, and back to Mr. Speaker.
Gracias, estimado doctor Matías, por tu presentación. Considero entonces poder dejar la sesión de preguntas al final de de la próxima intervención. Ya en el chat tenemos una relacionada a las recomendaciones del subgrupo de trabajo, que la tendremos en cuenta para más adelante. Ya como segunda espacio de nuestro encuentro del día de hoy, tenemos la intervención del doctor Michael Van sobre las estrategias para abordar las drogas sintéticas, una perspectiva desde los Estados Unidos. El doctor Van es especialista
Drug Enforcement Administration. And similar to Matthias had just presented earlier, our group is also responsible for drug and chemical regulations in the United States under our Controlled Substances Act. Okay, slides look okay.
Same request for you to move it into the presentation mode. You need to click slideshow at the top and then from beginning, please. Thank you very much. Please go ahead. And you may want to speak a little bit closer to your microphone if you don't mind, because it's a little bit boomy. Thank you.
Okay, can everybody hear me?
Please go ahead.
Okay, great, thank you. We're looking at drugs and chemicals that we regulate in the United States, and to do that, Substances Act. So in order to do that, we have several mechanisms, some of which involve interactions with our Department of Health and Human Services to conduct formal evaluations on both the scientific and medical aspects of a substance. Other mechanisms include temporary controls that DEA, or the Drug Enforcement Administration, can initiate based upon the finding that a substance is an imminent hazard to the public safety, as well as controlling precursor chemicals that are used in the illicit manufacture of controlled substances. So I want to
as well.
Gracias, Brian, por la atención a las preguntas que tenemos en el chat. Creo que en la sesión del día de hoy, con las dos presentaciones, desde la experiencia propia del gobierno de República Checa, con la presentación desde la Administración de Control de Drogas de Estados Unidos, pues nos muestran ese panorama de trabajo que se lleva a cabo en cada uno de estos países para el control, para la nueva interpretación tal vez de políticas públicas en materia de drogas, y creo que también tendremos el espacio más adelante, Brian, de poder comentarles la Política Nacional de Drogas de Colombia, donde también tiene un enfoque basado en la seguridad humana, en la salud pública, y creo que es un espacio muy adecuado para poder tener esta interpretación. Agradecemos claramente a cada uno de ustedes, a la participación, a la presentación de nuestros expositores expertos del día de hoy, y esperamos encontrarnos en nuestra próxima sesión del mes de mayo. Muchas gracias a todos, a nuestra nueva colega Natasha como copresidente, y esperamos que tenga una pronta recuperación. Gracias y un resto feliz día.
Thank you all so much. Take care. See you next month. Bye-bye, everybody.